Hello everyone, today's topic is about kidneys. So if we see the kidneys, they are retroperitoneal organs present over the posterior abdominal wall. So there are a pair of kidneys, we know it, and it is their retroperitoneal, means present behind the peritoneum on posterior abdominal wall at the level of T12 to L3. It is located between T12 vertebral level till L3 vertebral level. And right kidney is slightly lower. If you see the right one, it is slightly lower than the left one because of large sized right lobe of liver is located on the right side, which pushes down the right kidney. Next, about the location of liver, it is located in the epigastric region. Right and left, right kidney is in right hypochondric, left in left hypochondric, right in right lumbar, left in left lumbar, and umbilical regions. They are located. And most important landmark is the transpyloric plane, which passes in the upper part of the hilum of the right kidney and lower part of the hilum of left kidney. So lower part of the hilum of left kidney, upper part of the hilum of right kidney, the transpyloric plane is present. And this plane is an important landmark where it passes through the level of L1, lower border of L1 vertebra. And it is called transpyloric because it passes through the pylorus of the stomach. So let's see the relations of kidneys. So here is the image demonstrating anterior relations of right and left kidneys. Anterior relations of right and left kidneys are different because right side abdominal organs are different from left side abdominal organs. And this part of the kidney where we see the indentation is the hilum of the kidney, through which neurovascular structures and also the renal pelvis, which continues to form ureter, they go in and come out of the kidney through this structure. So from anterior to posterior, the first structure would be the vein, and then artery, that is the renal artery, and posterior most is the renal pelvis, which continues down as ureter. So we can remember as VAP, VAP. So vein first, artery, then renal pelvis. So let's see the relations of right side. So right side, it is related to the right suprarenal gland. So this is the right suprarenal gland. Large part of it is related to the liver, which is called hepatic area, visceral surface of liver. Then it is related to the hepatic flexure of colon, colic area. And it is also related to coils of small intestine, which is jejunal area. And along the hilum, we can see the duodenal area. Around the hilum, second part of duodenum is related along the hilum of the anterior surface of right kidney. So these are the relations of the right kidney. Let's see the left side relations. So the left side is left suprarenal gland. It is related. Left suprarenal gland is related. Left side spleen is also related. Splenic area. Then here is the suprarenal gland, and this is the gastric area. This triangular is gastric. It is related to stomach, and it is related to the pancreas, and it is related to the colon that and also it is related to the coils of intestine, which is called as jejunal area. So these are the anterior relations of right and left kidneys. Then let's see the posterior relations also. Posterior relations are similar on both right and left side. A little difference is, we know that the right kidney is little lower than the left kidney. So posteriorly, the right kidney, it is related to the 12th rib alone, whereas the left kidney, it is related to 11th and 12th rib both. So that is the major difference. Others are same almost. So posteriorly from above, it is related to the diaphragm. So this green shaded area is the diaphragm. Right kidney is related to right dome of diaphragm. Left kidney is related to left dome of diaphragm. Then it is related to medial and lateral arcuate ligaments. Medially, the diaphragm gets origin from medial and lateral arcuate ligaments, which are also related to the kidneys. And it is related to the psoas major. We can see here the impression of psoas major, which is near the hilum posteriorly. And lateral to the psoas major, this blue color area is the quadratus lumborum muscle. and still more laterally, it is transversus abdominis muscle. So from medial to lateral, psoas major, quadratus lumborum, and transversus abdominis muscle. So these are the muscles related, and it is also related to subcostal nerve, subcostal vessels on both the sides, right and left side, and both sides it is related to iliohypogastric nerve, ilioinguinal nerve. And right kidney is related to 12th rib alone, left kidney is related to both 11th and 12th rib. So these are the posterior relations of right and left kidney. We shall see the coverings. The kidney is invested by a firm capsule which is called as renal capsule, that is the true capsule of the kidney, which is surrounded by, so the around the kidney, this black line which is shown is the renal capsule. So this is the sagittal section of the kidney showing the coverings of the kidney. So if this is a schematic image to demonstrate the coverings. So this is the kidney. This black line represents the fibrous capsule of the kidney, and it is fibrous capsule is surrounded by renal fascia, which is a false capsule. This green color one is the false capsule, and between this renal capsule and capsule, this fibrous capsule and the renal capsule, the gap is filled with the fat which is called as perinephric fat. So perinephric fat lies in the perinephric space which is between the renal capsule and renal fascia. So renal capsule is the fibrous capsule which is a true capsule. Renal fascia is a false capsule which is peripherally derived from the fascia of the muscles which are near to the kidney. And the pararenal fat which is surrounding outer to this renal fascia, the based upon the different construction of a person, the amount of the fat differs. So it is pararenal, which is called as pararenal fat, and lies external to the renal fascia. So that is about this, and now we shall talk about the disposition of renal fascia. So this is the vertical disposition. So here is the horizontal disposition. So horizontally, if you take the kidney, we can see the hilum, the structures going and coming out. So the black lining is the fibrous capsule or renal capsule, and the green lining is the renal fascia. So that is about the renal fascia, and the fascia. Now this renal fascia we can again divide into fascia of Gerota, which is a false capsule which surrounds the kidney and perirenal fat, and fascia of Gerota, which is otherwise renal fascia. It is again divided into anterior and posterior layer. So this is the anterior layer and this is the posterior layer. So here you can see this is the anterior layer and the posterior layer. Anterior layer is called as fascia of Tolt and posterior layer is called as fascia of Zekerkand. The two layers are enclose the suprarenal gland. These two layers, this is the anterior layer and posterior layer, they will form separate this compartment for suprarenal gland. So we can see that kidney is completely separated from the suprarenal gland because of this renal fascia. And inferiorly we can see the two layers, they are separated and they are continuous with the fascia transversalis. Inferiorly they enclose the ureters, and laterally the two layers continuous with the fascia transversalis. You can see the anterior layer comes here and posterior layer, they join to form fascia transversalis laterally, and inferiorly they cover the ureters. They blend with the tunica adventitia of the ureters. So this is about the coverings of the kidney. If we see the macroscopic structure of a kidney, it is broadly divided into medulla and cortex. So we can see the medulla, it is present in the center of the, almost in the middle of the kidney, and peripheral part is called as the renal cortex. And this renal cortex and renal medulla contains almost 1 to 2 million nephrons in each kidney, and which are the anatomical and functional units of the kidney. So each nephron consists of a renal corpuscle. So this is the renal corpuscle found only in the cortex. So renal corpuscles are seen only in the cortex of the kidney, and it continues to form proximal convoluted tubule, then Henle's loop, and Henle's loop continues to form distal convoluted tubule, and finally drains into the collecting ducts. So these are the parts of nephrons. Collecting ducts, they all form like rays, which are called as medullary rays present in the medulla of the kidney. So let's see first one by one. Cortex. Cortex forms the outermost part of the kidney and also projects into the medulla in between, which are called as renal columns. And the medulla consists of pyramids, which are called as renal pyramids. And these columns, that is the cortex, which are the columns, are called as Bertini. They are the columns of Bertini. So you can see here, this is the cortex and these are the renal columns. In between is the renal pyramid. The dark colored things are the renal pyramids, and contain the renal cortex contains the renal corpuscles and the proximal and distal convoluted tubules. So the cortex, which is dipping down here into the columns, they contain the renal corpuscles, which consists of glomerulus and tuft of capillaries, which are surrounded by the glomerular or Bowman's capsule, and which is invaginated by the blind end of nephron. And medulla forms the inner part of the kidney, which contains mainly renal pyramids and renal columns, and which mainly contains straight loops of Henle, that is the Henle's loops and collecting tubules. And the apex of the renal pyramid, if you see the apex of the renal pyramid, they end up forming a renal papilla, and which fits into a cup shaped structure called as minor calyces. And these minor calyces, they join to form a major calyces. So 10 to 25 minor calyces are there in each kidney, which open up into the major calyces, and major calyces join to form renal pelvis. So the renal pyramid is with its covering cortical tissue, means renal pyramid along with this cortical tissue form the collecting forms each lobe of the kidney. So the renal pyramid along the covering cortical tissue surrounding this one thing is considered as the lobe of the kidney. And minor calyces receive again urine from the collecting tubule and empty into 2 or 3 major calyces. You can see one here, 2 or 3 major calyces, and major calyces in turn empty into the upper dilated part of ureter, which is called as renal pelvis. Let's see the blood supply of kidneys. Kidneys are mainly supplied by the renal arteries, right kidneys by right renal and left by left renal. And usually these renal arteries, they arise from the abdominal aorta at the level of L1, and in just inferior to the origin of superior mesenteric artery. The right artery is little longer than the left, and the right renal artery passes behind the inferior vena cava, and where it reaches the right hilum of the right kidney, and left renal artery passes posterior to the left renal vein. And at the entry of the hilum, each renal artery divides into 5 segmental arteries. First, it divides into anterior and posterior divisions, and anterior and posterior divisions. That anterior division branches into 4 anterior segmental arteries. So anterior division gives rise to anterior 4 segmental arteries, and whereas the posterior division continues to form one segmental, which is called posterior segmental. So totally there are 5 segments in the kidney. Anterior division divides to form 4 segmental arteries. Posterior division continues to form posterior segmental artery. So anteriorly the 4 segments are apical segmental artery, anterior superior and anterior inferior. Anterior superior segmental artery, anterior inferior segmental artery. and also inferior segmental artery. These are on the anterior side. On the posterior side continues to form one segment, that is the posterior segmental artery. So these segmental arteries are end arteries because they do not anastomose with any other arteries, so they are the end arteries, and they are clinically important because of its circulation. It creates an avascular line which is called as broadal white line, which is created between the anterior and posterior segments. So between the anterior segments and posterior segment, the avascular plane which is created because of the arterial supply is called as broadal white line, and which is in longitudinal section through the kidney. Usually it helps in the surgical removal of kidney, that is the important, which is called as especially during renal stones, staghorn caliculi, renal caliculi. During surgical section, vertical section, it is done along the avascular plane separating anterior and posterior halves of the kidney. So that is importance of renal arteries. And ligation of segmental artery results in the necrosis of entire segment of that kidney. And supernumerary renal arteries, in that 30% individuals will have accessory renal arteries which are also found, and they are commonly arise from the aorta, and usually at the lower pole of the kidney. Near the lower pole there may be some accessory arteries which are directly arising from the aorta. In 30% of the individuals we may find this accessory arteries. So here we can see an image, schematic image to understand the vascular segments. So this is the anterior division, this is the posterior. Posterior shown in dotted lines which continues to form posterior segmental arteries dividing into three. Anterior, we have got anterior apical, anterior superior inferior, then inferior segment, anterior inferior segment, then inferior segment. So this is the posterior side, apical, inferior, anterior superior, anterior inferior. So 1, 2, 3, 4, 5 segments. So apical, upper, middle, lower, and posterior. So venous drainage. So starts from the blood supply, we will start. So aorta gives rise to renal artery. Renal artery divides to form 5 segmental arteries which are end arteries, and segmental arteries divides to form interlobar artery, then they divide to form arcuate artery, then cortical radiate artery, then it divides finally to form efferent arteriole, then plexus in the glomerulus called as capillaries, then efferent arteriole, then peritubular capillaries or vasa recta, then cortical radiate vein, then arcuate vein, interlobar vein, renal vein, and finally drains into inferior vena cava. So the arteries and veins which are present within this dotted box represents the blood vessels which are associated with the nephron level. So nephron associated blood vessels. So the venous drainage is by peritubular capillaries. They are by peritubular capillaries which drain into interlobar veins, and which drain into arcuate arcuate veins, drain into interlobar veins. Interlobar veins drain into renal veins. We can see the renal veins finally drain into inferior vena cava. So the left is 3 times longer. Left renal vein is 3 times longer than the right renal vein. This is very important exam point of view. That is, the left renal vein is 7.5 centimeters and right renal vein is usually 2.5 centimeters. So for this reason the left kidney is preferred site for live donor or nephrectomy, and the left renal vein runs from the origin to the left renal hilum, posterior to the splenic vein and body of the pancreas, and then crosses the anterior aspect of aorta, and just below the origin of superior mesenteric artery it drains into the inferior vena cava. So there is a syndrome called as nutcracker syndrome, where it is characterized by the left renal vein hypertension, which is due to secondary to the compression of this vein between the aorta and superior mesenteric artery, and it is has been associated with hematuria, means blood in the urine, and varicocele in the children. So left renal artery, as left renal vein, as it is having a longer course, there is a chance of getting compression, and which may lead to nutcracker syndrome. And the symptoms would be hematuria and varicocele in children. And the left gonadal vein enters the left renal vein from below, and left suprarenal vein also drains into the left renal vein. And usually one left inferior phrenic vein enters into the left renal vein in the midline from above. So these are the veins which are draining into left renal vein, whereas the right side, right renal vein individually goes into the inferior vena cava, and right gonadal vein and the right phrenic vein, they all drain individually, they won't join with the right renal. Whereas on the left side, we have to note that left gonadal vein enters into the left renal vein from below, and also left suprarenal vein also enters into the left renal vein, and left inferior phrenic vein also enters into the left renal vein. This point to be noted. So let's see some more points. So venous drainage we know by right and left renal veins. Lymphatic drainage by lateral aortic or para-aortic lymph nodes, and nerve supply by celiac plexus, that is celiac plexus by parasympathetic, and sympathetic is by T10 to L1 segments. Applied anatomy, nephroptosis. Nephroptosis means downward displacement of the kidney, which is otherwise called as floating kidney, because of loss of supporting perineal fascia and also paranephric fat depletion. So depletion of this fat leads the kidneys to dips down from its position, called as floating kidney, which is otherwise called as nephroptosis. And here it is caused due to the loss of renal fascia, and it may cause the intermittent ureteric, because of the kidney dips down, the ureter may get kinked, it may bend. So because of bending of the ureter, it may cause obstruction of ureter, so leading to ureteric obstruction or kinking of ureter, and also a kinking of renal artery, resulting in hydronephrosis. Renal transplantation is one more thing which we have to know. So here is the transplanted renal new kidney. So where the left kidney is usually preferred for transplantation due to a longer renal vein course, and donor kidney is placed in the retroperitoneal in the iliac fossa, with the hilum parallel to the external iliac vessel. So you can see that it is located in the iliac fossa, where the hilum is parallel to the external iliac vessels, external iliac artery and external iliac vein. So the renal artery is anastomosed end to end to the internal iliac artery, and the renal vein is anastomosed end to end with the external iliac vein. So this thing to be noted. And then the ureter is implanted in the urinary bladder. So ureter, you can see it gets implanted into the urinary bladder, which is called uterocystostomy. And left kidney transplantation is preferred due to longer renal vein, this thing to be noted. And donor kidney is placed where? Retroperitoneally in the iliac fossa, with the hilum parallel to external iliac vessels. Right renal artery is anastomosed end to end with the internal iliac artery, and renal vein is anastomosed end to end with the external iliac vein. So the ureter is implanted into the urinary bladder, which is called as ureterocystostomy. So this is the two applied aspects about the renal transplantation. Next important is about the renal angle or vertebrocostal angles. So renal angle is between the 12th rib and the lateral border of sacrospinalis or erector spinae muscle. So here is the erector spinae muscle and here is the 12th rib. So if you make an angle along the 12th rib and the lateral border of the erector spinae, this angle is called as renal angle. So the angle between the last rib, 12th rib, and the lateral border of erector spinae, which is occupied by the kidney, is the renal angle. Vertebrocostal angle is occupied by the lower part of the pleural sac, where it is between the vertebra and the ribs. It is not between the erector spinae. Vertebra and the ribs is the vertebra. Here is the vertebrocostal angle between the lateral line of the vertebral column and the ribs. So this is not occupied by the kidney, it is occupied by the pleural sac. So from the posterior approach, these angles are very important clinically. So let's see some questions related to kidney. All are true about the right kidney. Right renal vein is shorter than left. Related to duodenum, right kidney is preferred over left for transplantation. Right kidney is placed at the lower level than the left. So which would be your answer? Obviously we know that the left kidney is preferred for transplantation than the right, because left renal vein is longer than the right renal vein. That is the main reason. Please note it down. Next, while exposing the kidney from behind, all the following nerves are liable to injury. So you have to remember the posterior relations nerves: lateral cutaneous nerve of thigh, ilioinguinal nerve, subcostal nerve, iliohypogastric nerve. I hope you heard of all these three nerves as posterior relations. So lateral cutaneous nerve of thigh is not related on the posterior aspect of the kidney. Nerves applied to the kidney is from lumbar plexus, celiac plexus, inferior mesenteric nerve. So you might have seen nerve supply is by celiac plexus. So kidney is supplied by the branches which surround the renal artery, carried from various sources including celiac plexus. So the nerves to the kidney arise from the renal nerve plexus, and they consist of sympathetic and parasympathetic, and renal nerve plexus is supplied by the fibers from abdominopelvic, and that is the splanchnic nerves, and visceral afferent, that is fibers conveying the pain sensation resulting from the obstruction or consequent distension of the kidney is due to sympathetic fibers retrograde to spinal ganglion to T10 to L2. Please note down T10 to L2. So the answer is celiac plexus. So this completes the clinical aspects of the kidney. Thank you.